Welcome to the Dr. Chan channel, Care Beyond Compare. In today's video, we will be exploring how gamification is transforming medical billing training. Let's dive in and see why traditional training methods are falling short. And how games could be the key to a better, more engaging learning experience. Most billing training in healthcare is like trying to teach someone to drive by. Handing them a car manual. It's way too long, super boring, and honestly, not helping anyone. Here is what flipped the script for us. We set up a simple quiz battle between two of our clinic's billing questions, real scenarios, and some friendly competition. No fancy technology, just points, prizes okay, snacks, and a leaderboard. And guess what? Our team started remembering stuff, mistakes went down. And people actually looked forward to it. One quiet coder came up to me and said, "That game? I finally get how modifiers work now." That is when it clicked. Maybe the problem is not the people, it's how we're training them. So, let's make billing training less terrible with these 5 easy wins. First, kick off with a quiz instead of a slideshow to get brains moving early. Second, turn real mistakes into learning moments. Case scenarios beat made-up examples any day. Third, track wins with leaderboards. Silly nicknames are totally welcome. Yes. Someone earned, queen of current procedural terminology codes. Fourth, make it team-based. Team challenges are less pressure, more fun, and lead to better outcomes. Lastly, keep it short and consistent. A quick game every week beats an all-day training session once a year. You're not alone in this idea. Smart people agree. Dr. Whitney Lynch, who teaches residents in Wisconsin, saw their billing scores jump from 42% to 67% after using games. She says the residents finally felt confident. Zulha Khan, a training strategist at Clinical and Surgical Practice Management, saw a 15% drop in billing mistakes. With staff and managers all in on the gamified approach. Dr. Trina Dora, a hospitalist who teaches billing basics, points out that we make doctors study medicine for years, but then leave them to guess billing. She believes games fix that. However, we've had some things flop for us along the way. Workbooks. No one opened them. Compliance-only sessions. Total snoozefests. Wing it sessions. Hello, audits. No tracking meant we didn't know what worked until we tried gamifying. Frequently asked questions are always part of the conversation. Is this too goofy for a serious topic? Not at all. It's not about cartoons, it's about getting results in a way people actually engage with. Does this replace full training? Nope, it adds energy and real-world context, making your training stick. Can you do this without a big budget? Yes. Start with platforms like Kahoot, Quizzes, or even Google Slides. It doesn't need to be fancy. Is it still compliant? Absolutely. Same rules, just delivered differently. Will this work for a small clinic? It might work better. You can test, tweak, and see results much faster. Real proof is always essential. The MedEd PARTL study on game-based billing training showed gamified sessions boosted billing test scores significantly. A report by Clinical and Surgical Practice Management found that healthcare organizations saw fewer billing errors and more team engagement after implementing gamified learning. Lastly, an American Medical Association article on gamification in medical schools highlighted how gamified training is helping future doctors retain information better. Billing doesn't have to be broken, and training doesn't have to be terrible. Start with something small, try one quiz, test one team, and keep what works. Join the movement, be the change, and start here. Let's fix billing training together. This isn't just about clean claims, it's about giving your team the tools to do their jobs better, faster, and with way less stress.